risk for thrombosis. What is the risk of thrombosis with regard to stent placement? The risk is low. That means less than 1% of thrombus can happen. This is after 4 weeks after PCI with plain balloon angioplasty, or if the duration is greater than 6 months with bare metal stent, or it is greater than 1 year with drug-eluting stent. Here the thrombotic risk is going to be very low. Intermediate risk, that is between 1 to 5%. If the duration is greater than 2 weeks but less than 4 weeks with plain balloon angioplasty, greater than 1 month or less than 6 months after bare metal stenting, or greater than 6 months or less than 12 months with drug-eluting stent, and even after 1 year with complex PCI with drug-eluting stent. For example, a long stent, multiple stent, overlapping small vessels, bifurcation lesion, left main lesion, and the distal vessels where you place a very small stent. Coming to high risk, where the risk of thrombosis is going to be greater than 5%. Here, less than 2 weeks with plain balloon angioplasty, less than 1 month with bare metal stent, less than 6 months with drug-eluting stent, less than 12 months after complex PCI with drug-eluting stent, less than 6 months for an acute MI, or if previously ST is there. There the thrombotic risk is going to be really high. Now coming to risk stratification of this thrombus. The patient with the coronary stent is coming for non-cardiac surgery. Okay, you have to look at the type of stent, where it is going to be bare metal stent or a drug-eluting stent, and you have to look for the time since implantation, how long before the procedure has been done. If the duration is less than 6 weeks with bare metal stent, it is high risk. If it is greater than 6 weeks, look for additional risk factor, which I will tell in the next scoring system. You look for additional risk factors like diabetes and renal failure and those things. And in drug-eluting stent, the time of implantation is greater than 1 year. You look for additional risk factors. If the risk factors are none, the risk is going to be very low. If 2 to 3 risk factors are there, there is moderate risk for thrombus. If there are many risk factors, there is going to be high risk for thrombus. In drug-eluting stent, if the duration is less than 1 year, it is going to be high risk for thrombus.